At this time, I would like to present Dr. Joycelyn Elders. I should state that Dr. Elders has been a supporter of Health Watch USA for well over a decade. I've lost count of how many times she has presented at our conference. I think it's around 15. Really, I consider a member of Health Watch USA. But more importantly, as you know, she is a renowned physician, educator, and public health advocate. And she was the first African American and the second woman to serve as the Surgeon General of the United States, appointed by Bill Clinton in 1993. She is known for her leading views on topics such as sex education, drug legalization, and abortion rights. She has also been a pioneer in the field of pediatric endocrinology, conducting groundbreaking research on growth and development in children. Dr. Elders will now present remarks regarding her thoughts and needs for vaccination. Dr. Elders, the floor is yours.
First, I'd like to obviously thank Dr. Kavanaugh for putting together such an excellent seminar. I think that this is really very important, and we should all work hard. And we've had such excellent speakers. And I learned a lot. So I'd like to thank all of the speakers for taking their time to speak at this webinar, and for all who attended and listened to the presentation. We hope we can return to a live format sometime in the future, but for now, the webinar format allows us to have both an international reach and to stay safe from COVID-19 and especially long COVID. Prevention of long COVID is critical, as we have just heard about. We now know that acute COVID is only part of the problem. Some are mainly concerned about the prevention of hospitalizations during the acute phase and state that children are rarely hospitalized. We all know now that they are. But the long-term effects of COVID in children are real and concerning. After the acute infection, children can develop cognitive difficulties, multisystem inflammatory syndrome in children, MIS-C, and immune hypofunction. Prevention of long COVID is critical. We think about the neurological problems in children. We especially worry about the lingering physical, mental, and neurological symptoms affecting children, as well as adults, including many who have mild initial COVID infection. At Boston Children's Hospital, this program draws long COVID patients from across the country. They're seeing many with fatigue, headaches, brain fog, memory and concentration difficulties, sleeping disturbances, ongoing changes in smell and taste. We heard about some of the long-term COVID symptoms in adults, and now we know and we're seeing and know that many of these also occur in children. We know the prevention of long-term COVID is vital. This is a slide demonstrating some of the public health functions in Sweden. There's mounting evidence that COVID-19 can affect one's ability to fight off disease, at least for a period of time. In Sweden, a country with little public health interventions, and a country which kept public schools open, large surges and respiratory syncytial virus, RSV infections, were seen during the epidemic. We've got to prevent long-term COVID. And of course, we already know the best way to prevent long-term COVID is not get COVID. MIS-C is a serious, the rare condition in which their body's own immune system overreacts to SARS-CoV-2 infections, resulting in inflammation of multiple organ systems throughout the body. We heard how it affects the heart, the blood vessels, GI intestinal organs, the lung, and other respiratory organs, kidneys, skin, eyes, nervous system, and it can even cause shock and even organ failure. We do not see this in most cases in children, although everything that you see in adults, we can see in children, though it's often less. We know and we think, and you've heard today, COVID-19 vaccines have been found to prevent severe COVID disease and decrease the risk of developing MIC by 91% among children aged 12 to 18. And heaven knows we want to present these severe consequences in our children. We know that vaccine hesitancy, and you've heard about how vaccine hesitancy all over the world is reaching disturbing levels. In October 23, only 5% of Californians, or 1.8 million people, had received the updated COVID-19 vaccine since it became available last month. Among seniors, those old folk like me, the rate is 14%. I want you to know I got mine and recommend that all parents and all children and all seniors make sure whether we get our COVID-19 and our booster. We know that 5% or 14% is not good enough. We should be seeing much higher rates, and not only for our old, but also for our young. Winter is coming. We must get our vaccine. Vaccine hesitancy. Again, you've heard how all across this country, both from our politicians, our TVs, our newspapers, everything, hesitancy is reaching critical levels. Rates and the rest of the nation, not only in California, but also all over the country. A month after federal officials recommended new versions of the COVID-19 vaccine, 7% of U.S. adults had gotten a shot. I think that the Technology Institute has developed excellent vaccines for us, made them available. They've made them available across the country. They're free, and we've got to do the things we as adults or communities all got to become involved in making sure that all of our citizens become vaccinated. We've got to overcome this problem. Long COVID is a risk to all, including our children and our furry friends. You know, many of us won't get our children vaccinated, but we get our furry friends vaccinated. The best way to avoid long COVID is not to catch COVID-19. And the best way to avoid getting COVID-19 is to become vaccinated. Many times we talk about worrying about the adverse effects of vaccination. Think about all of the adverse effects catching COVID-19. We need the things that we can do is to wear high quality masks in high risk settings. Masks should be high quality respirators and without an exhalation valve. We can't succumb to peer pressure. We have to do what we need to protect ourselves, our community, our friends, our family, and all of those around us. We have a responsibility to us. We have to do what we need to do. Long COVID is a risk to all, including children and our furry friends, our dogs and our cats. Viral reservoirs in an infected person's organs are felt to be one of the causes of long COVID. COVID-19 vaccines can help to lessen long COVID symptoms in many patients. As of September 2022, less than a year ago, only 1/2 of those at age 5 years and above had received a booster shot. And those above 55, they're getting to be old folk like me, only 1/3 received a second booster shot. And we also need to make sure we get the next. The current booster is effective for the circulating variant, BA.2.86. This new booster is recommended for all ages, 6 months of age and above. So we need to get it, and our children need to get it. By far, too few of us are becoming vaccinated and boosted to COVID-19. And I want you to know, we talk about the lines. Think about our lines if we don't go. Moderna is going to reduce production of vaccines because we aren't getting them. Moderna said on Tuesday it will cut production of COVID-19 vaccine at its facility in Switzerland. This is part of a plan to align manufacturing of shots with lower post-pandemic demand. That means they're going to stop producing the shots because we aren't getting them. We need to make sure we go out and get our shots. So I feel very strongly that we must get our shots. Because of our anti-vaxxers, we aren't going to get our dogs vaccinated. Researchers have studied vaccine hesitancy in our furry friends. And because of the growing mistrust of pet owners over vaccines for cats and dogs, almost 40% of dog owners believe that canine vaccines are unsafe. More than 20% believe these vaccines are ineffective. And 30% consider them medically unnecessary, according to a new study published in Vaccine Journal. 70% of dogs need to be vaccinated to prevent rabies outbreaks. Most of you have never seen rabies, but it's something you never want to see. And we need to make sure we get our dogs vaccinated and our cats. Because of this, we're beginning to see measles again. Nearly 40 million children are dangerously susceptible to growing measles threat. Measles vaccine has been declining since COVID-19 pandemic. In 2021, record high worldwide of nearly 40 million children missed a vaccine dose. 40 million. 25 million missed the first dose. An additional 14.7 missed their second dose. So I think that this is a real problem. This decline is a significant setback in our global progress toward achieving and maintaining measles elimination and leaving millions of children susceptible to infection. I remember measles, and it's a horrible disease. In India, over a 6-month period, there were 36,000 cases of measles. This is also a high incidence in many Middle East countries. According to the CDC, measles in the United States is the most infectious disease known to mankind. My children used to, when we had measles going around, we wonder when were they going to get it. But they didn't have to wonder long because they were going to get it if anybody in the class got it. And we must not let our guard down, because if people start getting the measles, it's easy to have important, very important outbreak. And this is a kind of an overall summary that we don't change our direction and start doing what we need to do, get ourselves vaccinated, get our children vaccinated, we're going to end up with a lot of the signs and symptoms of long COVID. And we don't realize what our problems are and don't set our goals. Our goal is to eliminate and get rid of COVID-19. And if we don't work hard and get rid of this virus, we can see some of the symptoms, the neurological symptoms and other kinds of symptoms we're likely to get. We've got to all be involved. We've got to involve all of our children, our neighbors, our churches, our preachers, educate our politicians. They are saying things that they're saying because they don't know better. Educate our TV people. I know they're slow learners, but we've got to work and make sure they are educated, because we don't educate them, change our direction, make sure that we all get vaccinated, we're likely to end up where we're headed. And I want to thank you for all those of you who've listened, all the hard work you've been doing. and for all the hard work we still have to do. And I especially want to thank Kevin Kavanaugh for all the hard work I know he's had to do to get us all organized. Thank you.